I am a dentist and started practicing back in 2018. Graduated from NYU Dental, had a bunch of different associateships, started to burn out on the basic bread and butter dentistry. I felt like there was more to this profession. Basically invested in myself to learn more procedures. So I learned implants and I learned aligners. Started over 50 cases in my first 6 months. That snowballed into me starting to teach the other dentists that I was working with, kind of like mentoring them. So then I started doing one-on-one consulting with dentists on the side. I started my own consulting business. And to get more clients, I started posting on social media. I think everybody can win. I think more patients can get served the more that providers actually have that foundational education. I feel super fulfilled and I'm really happy with what I'm doing. So dentists are clinical entrepreneurs. They're doing all of this and they're clinically practicing.
Welcome to another segment, another video of Dental Dialogue. Welcome, guys. I am very excited because today we have a guest that I've been trying to set up for a very long time, so I'm happy to have them here. We have Dr. Avi Patel. He's a dentist who's doing a lot of cool stuff and a lot of new stuff in terms of clear aligners on social media. The founder of Clear Aligner Advisor. Welcome. Thank you very much for joining us.
Yeah, thanks for having me. Sorry it took so long to get something set up. I know it was crazy, everyone's schedule. I just tapped into kind of leaning into having my assistant do a lot of stuff before it was just the one man show. And yeah, part of growing as an entrepreneur is delegating. So I'm glad we could make that happen.
Yeah, I'm glad as well. It's not your problem at all. I understand everybody is like super busy, especially at the moment. I think I don't know why, this time of the year, everybody's like locked in. They've got loads of responsibilities and prior work. But yeah, thank you very much for joining us today. If you could, for people who somehow have not seen your social media, explain a little bit as to what you do and maybe what you post about.
Yeah, totally. So basically, I am a dentist and started practicing back in 2018. Graduated from NYU Dental, came out, had a bunch of different associateships, started to burn out on the basic bread and butter dentistry. I felt like there was more to it. I felt like there was more to this profession. And so I basically invested in myself to learn more procedures. So I learned implants and I learned aligners. I found a mentor, Dr. Christina Blocker. She helped me get started with aligners, and then I started implementing it in the practice. Started over 50 cases in my first 6 months. I didn't think this was special. I just thought that's what's supposed to happen. The reps that were in charge of my territory told me otherwise, and they were like, "What are you doing?" And I was like, "I'm just talking to my patients about it." They're like, "Okay, well, how are you talking? Because this is not normally the trajectory that people start off on." And so then I was like, okay, and then I kind of told them, like, look, I'm focusing on the oral health perspective, and I'm just kind of being real with my patients. And that snowballed into me starting to teach the other dentists that I was working with, kind of like mentoring them. That's where I found my next passion in life, which was actually mentoring and coaching. So then I started doing one-on-one consulting with dentists on the side. I started my own consulting business locally here in Austin. And to get more, clients, I started posting on social media. So I started posting about clear aligner tips, learned how to make reels. This is back in 2022 because I just didn't have any extra money and I just didn't want to invest in the marketing side. And I was like, let's just do this free social media thing. Everyone says it works. And so my mom actually put me on Grant Cardone's 10X rule book. And I just really got fascinated with the idea of omnipresence. And so I was like, cool, I'm gonna do this. And then I started making content. I made YouTube videos, reels, and just stayed consistent with it. And ended up creating an online course because doing the one-on-one consulting, it was hard for me to really kind of bring value to all the clients. And I just wanted to have more reach. Honestly, I wanted to help more dentists because I was in a place where, like I said, I burnt out on dentistry. Doing clear aligners reignited my passion to actually practice because I felt like I was able to make a bigger impact. And then the
Mhm.
next level for me was like, okay, I I just felt pulled to teach other dentists how to do this, because dental school doesn't teach you how to do this procedure. Um, Even though every general dentist is capable of doing it, it's not rocket science. I do think the specialty of orthodontics is extremely valuable. I refer to orthodontist specialists, all the time. I did it more when I started offering aligners. And yeah, I think everybody can win. I think more patients can get served the more that providers actually have that foundational education. Um, and then yeah, so I started doing that about 2 years ago, and then last year I decided to go full time with it. So I walked away from practicing just to focus mainly on this. So full time making content, supporting the doctors in my program, and then yeah, looking to continue to grow it. And yeah, now to date we've got over 180 doctors that are in there, and I feel super fulfilled, and I'm really happy with what I'm doing.
Yeah, it's great. Yeah, it's actually amazing, especially because it's kind of, yeah, it's kind of the same story. I think you're the first person that we are talking to that actually straight like turned its back towards practicing. That is something that for us also during we had this realization already in school, in dental school and med school, where we were like, yeah, like to do this all your time. And I think especially dentistry is one of the, let's say, most demanding jobs out there. There's nothing comparable because you need kind of um all these components that you have to be doing
I
all
call it,
day.
so dentists are clinical entrepreneurs. So
Yeah,
now that I'm a full-time entrepreneur, I'm thinking about all the dentists, and it's like they're doing all this and they're clinically
yeah,
practicing. So
yeah.
it's like it's
Yeah,
nuts.
and it's not possible. And I think in the US, what is good that I see that in comparison to Europe, that in the US especially, they understood that. So they get people in, they kind of understand that it's a business and not just yeah a practice. What most people
Mhm.
say it's their business. What would interest me is what way or would you recommend in general dentists to go down? Would you say to also start content. What is your kind of view on the marketing side?
Yeah, so if I had my own practice, or if I was practicing, didn't even if I wasn't an owner and I was an associate, I would be making content for the people who I'm trying to serve. So if I am trying to get more patients, I would make content for patients. I would address their pain points. I would show my real self. I would basically talk as if I talk to my patients. I would show parts of my life because basically nowadays, if you don't have a presence online, you don't exist. Um, every day that goes by, less and less people are going to Google to search, right? Normally, if you go to a restaurant, you're looking on Instagram, you're not searching them on Google. If you are, same thing goes, right? For like, if you're looking for a healthcare provider, I mean, sure, I'm not saying you, if you're not on Google, you don't exist. You should definitely have a website. But the very next thing, if it's not the first thing, is they're going to go look you up on Instagram.
Yeah,
And that is where the advantage is and the opportunity is in the market, where if you just have a presence, and I'm not talking stock photo garbage, like I'm talking
yeah,
just real content, even if it's like of your front desk person with their iPhone camera and it's bad quality, if it's just capturing what it feels like in the office, that's all people want. Sure, you can invest in editing and professional stuff. And I think that's great because if your brand is like that and you can deliver at that high quality, then you should showcase it. But if you've got, it's like a standard practice that's meant to serve the average person and that's your sweet spot. Honestly, having high end camera Instagram presence probably doesn't, that's not an alignment, right? It's not brand
mhm,
alignment. You should probably have a very standard thing, which makes it even easier, right? So there's just no excuse, in my opinion, to not have some type of presence. And the dentists that don't lean into making content, they're just falling behind. So that's kind of my take on it.
Yeah,
yeah,
you hopped on something which was like it's the exact phrase that I use whenever we're speaking with our partners in terms of either shooting content for their organic profiles or shooting content for the ads that we're running for them, I'm always saying, look, you've got to imagine in your head, can you bring out the essence of your practice in this video? That's all you have to be doing. Somebody watching the video just has to be assured that when they're going to the practice, it's going to be exactly how it looks like in there. It looks really familiar. You get to see the people's faces in terms of the staff and everything like that. And it's for me, it's a real shocker that not a lot of dentists, now that the social media wave has like kind of come and is here to stay, that a lot of people aren't jumping on that. Why do you think that is compared to maybe some other fields?
I think it's mainly because a lot of dentists just have a lot of self-doubt, and I think they're afraid of that exact reason, right? We are saying be authentic, be real, show what you're going to get. I think a lot of dentists, they're not proud of their practice. They're not proud of themselves as clinicians. I think there's a lot of dentists that have self-doubt because a lot of dentists suffer from perfectionism. And I think if you put a camera and record it and put it out on the internet, that terrifies the crap out of them. And I'm speaking from experience because when I was practicing, I never worked. The last practice I worked at was the nicest practice I've ever worked in. Everything else was like, they just weren't, that's not what the vibe of the office was. And so I was not proud of some of the places that I worked at, but I did because I had a job and I needed, I had patients that I needed to help. And so I think what it is almost is it's like maybe giving those dentists the permission that like, hey, it's okay if your practice doesn't look like, the top cosmetic practice. Like if you're not offering top cosmetic procedures, why would it look that way? Like somebody
if you're not targeting those people, like we know some clinics that are like top-notch clinics, but the people that are working in there are celebrities or just like wealthy people. But for the ordinary people, I think that's what people want to see. I remember we had our very first client send us the shots and we were like, this is so bad. Like the clinic looked bad. The shots were done so bad. They were filmed like horizontal and not even on an iPhone. It was really bad. And we were running out of time. I was like, okay, look, we're just going to edit that, put it out. And the ads were working. The thing is, and I think that's super important, also think that what you said about the perfectionism, it's kind of the same problem that we had because we come also from the background of content creation. We had like a YouTube channel with like total 25 million views. During our studies, that was our first business. We had a super high production, like quality was really, really good. And then going into that, and then you need the footage of the people, we had to also accept that and be like, okay, look, this is just how it's going to be. But the funny thing is, this works much better or the same way, like the professor of us that we did the marketing for, where we filmed with a Sony A7S III and stuff, and it was no difference at all. So just for everyone listening, you really just need an iPhone to get started.
That's it. You need the iPhone, and honestly, the thing is the bar. There's never been an easier time to start making content, and the bar has never been lower. Like the competition, right? If you subscribe to competition culture, if you are actually trying to compete with people, which I don't think you should, but if you are, there's no competition. Like no one else is actually doing it in the grand scheme of things. So it's like if you just record and post, like you're already winning, right? And I think, it's just like a sleeping giant that people are, not taking advantage of. And I think there's a lot of fear. I think there's a lot of doubt, but I think I'm also walking proof. Like nobody knew who I was 2 years ago. And here you guys are from across the globe. You guys know who I am. You know my story. You know what I'm about, and it's mutual. Like I've seen your guys' ads. I love the one where you took the whole like bull and jumped in the chair, or whatever, and you're like, oh, like I thought I was gonna do that. Like that was good. I was like, that was like the next level for me. It was like, oh, you took a trend and then you flipped it on its head. So, but that's what's cool. Is like this industry is not actually that big. So you can make an impact very quickly. But content is how you speed it up. So yeah, I think a lot of it too, right, is like just kind of wrapping that up is like you're like dentists, they feel as though sometimes they hide behind the curtain. So here in America, like everyone takes dental insurance, but then they complain about the reimbursement rates. And so
Yes.
the solution is like, well, why don't you just stop taking the insurance and just charge people what you should? And they're like, oh no, but then I'll
Yeah.
lose my patients.
Mm.
But it's like, yeah, so that's the problem. Your patients are coming to you because of your insurance. They're not coming to you because of you. But if you actually gave them a reason to come to you for you, you could charge those people accordingly, because like with any business, with any service, with any product, people are going to be attracted to the thing that they want. And so I think dentists just need to kind of lean more into themselves. They're unique and they do care and they will provide great service, and just know that they will attract, right, their ideal patients. And there's a reason why there's dentists out there who don't take insurance, because they've invested in themselves to learn skills that other dentists have not learned. They're providing top-notch care. They're paying their staff more, provide a better service, and they are doing, above average dentistry. And so to all the dentists that feel like, the ones that are listening, and if you feel like you are doing work that is better than average and you want to charge accordingly, well, then lean into that, because you will attract the patients who want above average care. But if you're just going to sit behind insurance, most patients are coming for insurance because they just want the basics. And unless you have a strategy on the back end to like actually ascend them into like, some specialized procedure or specialized offer, which most of them don't because they don't really understand business. But if they do, great. Yes, you can use insurance as a funnel. Most of them don't. They just think, oh, I got 50 new patients this month or 20 new patients this month. And like they just want their cleaning. It's like, well, what did you think they wanted? Like, that's what they came in for, the
Yeah.
free cleaning. And then, you know what I mean? So
Yeah,
yeah,
100%.
there's a whole business side to it. But my advice to dentists is like, if you have invested in skills outside of the basics, you should heavily consider like charging accordingly, pretty
Yeah.
much.
Yeah.
I mean, we have, I think, just over, or I would say probably half of our partners don't accept charges. They just want strictly PPO patients, and that's awesome. But as you rightly said, what I can see a trend with those kind of clients that we have is that they put a lot of investment in probably three things. The first thing is something you mentioned is that mindset thing of being sure in their practice, in their systems, also in their staff, and being sure in the staff, not just with marketing, which can come externally if you hire out to a team or you get people who actually know how to market your practice properly, but also in terms of sales. That's a huge component that would help build the confidence so that when the marketing comes into play, you can sell even more and you can build your practice up much higher. But yeah, I would say those, including that fears, those three things that are holding people back with growing their practice, especially with just PPO patients.
Yeah. What would you say, just maybe for the people who are, especially the young dentists who might be watching this, what would be steps that you would recommend? I saw one of your reels even comment on that, where you said, look, you should not in dental school just try to have the best grades, and because top of the class doesn't buy you anything. It was the same for us half through the university. Like, you know what? We started the business thing. It became big. We're like, we just tried to pass. We went from, I was top of the class. I went to just average, and I was like, fine with that. What would you say is the thing that you would recommend everyone who's not in school anymore, but just is coming out and sees this and is like, wow, I want to maybe do something to actually prevent ending up like the other dentists?
Yeah, I would say just don't be afraid to look at this as career as like, there's like a true business component, a non-clinical piece to what you're trying to do. And it's a blessing and it's a curse. So, you need to start at the very minimum, just start consuming content that is not related to clinical dentistry. Start consuming business related content. Consume sales content, how to speak to people, how to overcome objections, how to present value. All of that can translate to your practice. Like even if you're doing fillings and crowns all day, if you like, you're going to be able to do, and if your goal is to be as successful as possible, you want to increase your income. Like if that's how you're aligned, which I mean, most dentists, I mean, obviously, yes, you want to take care of your patients, but like you're going to want to take care of as many patients as you can, which will result in making more money. Then you need to understand the process of sales and communication, right? So my advice is start consuming content from people who are educating on sales and communication, because if you can take someone's problem, meet them where they're at, and then communicate the value behind what you're doing, even if you're just doing fillings and crowns all day and that's all you want to do, you don't want to do high-end procedures, veneers, any of that stuff, you can do so many more of those treatments if you just get better at communicating to them. It's like when I first started, I didn't know how to communicate to patients. I'd be like, "Hey, there's a cavity here. We got to do a filling. We should do a filling. I think we should." And then it's just like patients like, "You should do a filling." So like, and then they'd be like, "Well, can I just wait?" And then I'd be like, "Well, I mean, yeah, I guess, but it's better if we just like do it now." And they'd be like, "Well, how long has it been there?" And then I would be like, "Well, I mean, I'm sure it's been there for a while." Like, "Oh, we'll just wait." Whereas if I would have just, been more confident and actually explained to them, "Hey, there's a cavity here. This thing is only going to get worse. It's already broken into to the next layer of your tooth. So, we're better off taking action now versus if we were to wait, this is only going to become more expensive to fix. And so right now we're in control. It's very predictable. Let's go ahead and get you scheduled for that filling. Are you available, tomorrow, 8 a.m.? We just had something open up."
Yeah, that
What are you
sounds
gonna,
good.
what are you gonna say? You're probably gonna be like, well, no, I can't do in the morning. Can I do in the afternoon? I'm like, yeah, cool.
Yeah,
Like it's not like my job is to take care of your oral health. When there's a problem,
100%. Yeah,
that's it. It's a problem. I let you know. I communicated it, and we're doing it. Like this is not a back and forth. You tell me if you think we should do the cavity. Like, and that's
yeah,
the thing.
exactly.
You have to
I
own the
think
conversation.
Yeah, I think also it's the responsibilities of dentists and doctors, because there are people who look at it like, yeah, like marketing in the dental field, it's just about money and whatever. And I'm
Don't want to be
always
too
saying, no,
pushy.
it's our responsibility. If you're convinced that you're the right person to treat and that you offer the right treatment, it's your responsibility. If you think that you offer something that is not good for the patient, that's where maybe this thought process is coming from.
Yeah, because
I
you can't just put your hands up and be like, "Hey, this is what's going on." Like, yeah, in some cases, if you know you can deliver and you have that confidence, that's some people. Everyone has different styles. I'm not saying there's only one way
yeah.
to do it, but that comes with time. Whereas in the beginning, if you do that, a lot of people are just gonna be like, "All right, I don't think this guy knows what the hell he's doing." So yeah, I'm just gonna go somewhere else, or like I'm not gonna
Yeah.
do it. So
Yeah, 100%. Yeah,
yeah.
if you just want to plug your YouTube channel really quick, just tell the people what you post about, since we just talked about it.
Yeah, so basically I do a lot of clear aligner content. I also dabble into just like dental related stuff. So if you are a dentist, doesn't matter if you're just starting, you've been in the profession for a while. I just try to share as many tips as I can. A lot of it is going to be clear aligner focused, right? So um, just pretty much trying to make that type of education accessible to as many dentists as possible, because that didn't exist when I was first starting out, and so that's what I'm trying to kind of do for the next generation.
Perfect. Great.
Awesome. Yeah, all of your links will be down below. So if anybody wants to check it out on YouTube or on Instagram, do you have TikTok as well? I'm not. I'm not.
Yeah, I
TikTok
post there. I'm honestly most active though on YouTube and Instagram, but there's content on TikTok.
Great. Yeah, this was a short but very, like, I think, insightful episode. So
Yeah.
for everyone who's enjoying this type of content, don't forget to subscribe to not miss out on further content all around dental marketing. And we thank you so much for your time, Dr. Avi. And yeah, maybe we see us in a part 2.
Yeah.
And yeah, wish you a great rest of the day.
Sweet, I appreciate it, guys. Thanks for having me on. Looking forward to seeing what you guys are doing and to continue to grow, and I appreciate it.
Cheers. Right.
Thank you so much. Yeah, it
Cool.
was
Yeah.
a great episode.
Yeah, sorry for that bit there at the end of pushing, but I just want to let you guys know I had
No problem at all.
No,
I mean,
we're just time conscientious. Like we're like, we don't want to.
yeah. And also the
just
thing
go
is
over.
that we think that these short episodes, yeah, before we had a past podcast with the other content that we did, and it was we had episodes of like 1 hour, 2 hours. and it's just the people. I mean, we know ourselves when it's super long. You see the time already, the timestamp, like
Yeah. You're like, I don't have time for
Yeah.
this. Yeah, that's
yeah,
good though. That's good.
yeah,
Yeah. And then if you guys get, positive feedback, or if there's stuff that comes up that you guys want to talk about, just reach out. Happy to have conversations like this. I like it. I like the fact that you guys have the background and just committed. Honestly, lean into it. Yeah, having the doctor with associated and having gone through it, that does give you guys a leg up in the space, but like don't be ashamed that you guys aren't practicing, because honestly you're
Mhm.
helping. The way I this is how I this and this is I don't even know if you guys are looking for advice, but I'm just going to share it.
No, 100%. Yeah.
For me, when I first walked away from practicing, it felt weird because I was doing something very different. But I knew I needed to go in that direction, and I'm sure you guys knew you needed to as well. If you look at it this way, if you practiced, you would have only helped a certain number of patients. But now, since you're actually doing this, you're helping more doctors help more patients. So
Yeah.
as long as you put your ego aside and know that like your own two hands don't have to be in somebody's mouth, or, going down the route of physically doing that. And you are able to like just be a part of multiple patients' journeys because you're helping doctors get more exposure through marketing. I mean, that's the win.
Yeah, that's
Yeah.
actually good advice because honestly speaking, for us it's very fresh. We graduated like 2 months ago and we don't even have our documents yet, so we can't even work at the moment. And yeah, it's a bit tough at times because especially the surrounding, everyone's like, yeah, when do you start working? Why don't you work? What is up with marketing stuff?
Yeah.
Why the US? Why this? Why that? And as soon as we found you actually as the first person really going down that path that we kind of started, we didn't know anyone who did that before. I think it's great, and we for sure will come back to you with questions or advice in the future.
Yeah, totally. I'm happy to help. And that's the thing is like, like I said, this space isn't that big. When you guys have a plan, commit to it, do it. Don't be afraid to pivot if you need to, but there's so much opportunity in the dental space. So yeah, um, just be patient, because that's the hardest part, because dentists move slowly, but when you catch momentum, you just ride the wave, my man.